We have an epidemic on our hands, and we really need tools in the hands of public health and safety to fight this. The general consensus among a lot of our public health partners is that there is a consistent lack of real-time data.
Jeff Beeson is Deputy Director of the Washington and Baltimore High Intensity Drug Trafficking Area, or HIDTA for short. Beeson's team developed a way for first responders to enter overdose information in real time to help bridge the data gap plaguing the opioid epidemic.
The real purpose of the program is to make sure that our public health and public safety officials have real-time data to respond to an overdose threat or an overdose spike. So if I get a spike alert from my neighboring county, I know I'm going to be hit in the next 8 to 10 hours. I can make sure that my people are out in the field or out in the community. I can make sure the hospitals are aware. I can make sure my officers, my EMS, and my providers all have Narcan or naloxone and are ready to deploy. Those are the important things that real-time data are going to help you with.
So I'm in Anne Arundel County, Maryland, and according to police here, they're only behind Baltimore City and Baltimore County when it comes to how bad the opioid usage is here. Because of that, they're chosen to be one of the pilot areas for the ODMAP.
You know, now we're getting live data. It's coming in. So within usually 4 to 5 hours of a fatal overdose, I'm aware of it. Sometimes sooner.
Is it easy to use? It sounds like it's a click, click, click.
It's very simple.
ODMAP stands for the Overdose Detection Mapping Application Program. Here's how it works. First responders arrive on the scene. As some medical personnel tend to the patient, others can log into the ODMAP website on their phones, where they can pick one of 6 options. The information, like GPS mapping, is saved to the database and other members can use it.
We know how difficult it is to be a first responder. We know how many priorities our police officers have. We know how stressful the jobs of our firefighters and EMS can be. So we wanted to make the system that simple.
The program was successful during tests. Beeson says he thinks the data could eventually let first responders predict patterns in overdoses. But that can depend on the number of officials using the ODMAP. Right now, first responders aren't required to use it, so getting every state and jurisdiction on board with the voluntary system will take time. As of September, the program is active in 74 counties across 19 states. Beeson said he and his team will continue to spread the word about ODMAP state by state, municipality by municipality. They have just one goal.
Let's share our data. Let's make sure that we're getting resources in the hands of those who are in the best position to respond so that we can safeguard our communities. Last thing we want is anybody else to die. I mean, that's really what this is. We're trying to save lives.